Thanks so much for joining us this evening, everyone. My name is John Nelson. I am an Associate Vice President for Nuvance Health with our Community Government and Public Relations team. I so much appreciate you joining us this evening for this Sharon Hospital Community Forum. To get us started, I'd like to introduce Dr. Mark Hirko, who is the president of Sharon Hospital, and he will do the presentation. So just as an FYI, we will have a Q&A session at the end. If you have questions, you can please feel free to enter them into the chat or the Q&A function, and we appreciate it. Rick, we do see you on there. If you want to turn your camera off, we'll get started. And
okay.
Mark, I'll turn it over to you.
Great. Thank you, John. And good evening, everyone. Welcome to our, I always have an issue, is this biannual or semi-annual presentation regarding Sharon Hospital and our community forum. So, next slide, please. So here's our agenda. We'll have our welcoming remarks. We will go over our hospital updates, going over various aspects of something that we've all been apprised of, including COVID-19, flu vaccine, various developments that have occurred in the community and the hospital and the system recently. Our quality performances across various areas, various awards, and just our community activity and advocacy throughout. We will then also go over our affiliation update through our certificate of need, and then move forward with our independent monitor presentation as we move on to question and answers afterwards. So next slide, please. So let's go over our COVID-19 updates. Next slide. As everybody knows, I mean, safe care is our top priority. We as a health system and as a hospital test all our patients currently scheduled for surgeries, and employees are really screened too before they come in, and we follow all the CDC guidelines as we go through. I know it sounds like a broken record, but actually it works. We use hand sanitizer throughout our hospitals and our various medical practices, and face coverings are required. And we currently offer virtual visits for non-urgent medical issues. And this is something that, we would have mentioned this 2 years ago, that we would have virtual visits for certain parts of medical practice. This was essentially unheard of. We thought it was coming down the pike, but really COVID pushed the technology and pushed medical practices into this realm, and actually we are the better for it, and it's helping us out in a lot of areas. As noted, our visitation policy has been changing and evolving throughout this 2-year time course. And if you have any questions regarding our current visitor policy, please check our website. Each hospital has some variation based upon the intricacies of the patients they care for. But all in all, we're encouraged by just the ability now that we can have visitors in our facilities. Next slide, please. So let's talk about boosters and COVID-19 vaccines. The take-home point is that vaccination really is your best defense against this issue, and it works. The data, if you look across the board, I know I was looking at state of New York and the state of Connecticut just yesterday, and of the hospital beds that are currently occupied for COVID, greater than 75% are actually unvaccinated patients. So again, this is fitting the motif that vaccinations do help. And only in our county alone are we seeing a little greater than 67 to 68% vaccination rates. So we're kind of stuck on that number. We are currently seeing signs of a surge in both the borderline between Connecticut and New York. Upstate New York is seeing, and western parts of New York are seeing a very large surge, and our infectivity rate, which just about 8 weeks ago was down to about 1 to 1.5%, is currently running at 8% in our region, which is one of the highest we've ever seen, and 5.5% in Dutchess County alone. So I'm just concerned that again we are seeing unheard of, or not unheard of, but a repeat of rates that we haven't seen in almost 8 to 10 months. And almost all of these hospitalizations for COVID positive patients at Nuvance Health are non-vaccinated also. The Omicron variant is currently out there, and the CDC is showing that over the next 7 to 10 weeks, it probably will be the most prevalent variant out there. Boosters currently in the early data have been shown to reduce risk and hopefully will help with less severe disease. But again, the data is still very early here, and again, I'm a big believer just to say, look, if you haven't been vaccinated, please be vaccinated. And if you're eligible, please move forward with a booster at this point, because they really do help to stem what we're seeing. Next slide, please. We really want to congratulate our teams at all of our facilities, including Sharon Hospital, really for continuing to bring safe care to the bedside. And really, we've evolved care regarding COVID itself. Yes, we do require vaccines, but what did we do early on? We didn't have the vaccines out there. We social distanced, we wore masks, we washed our hands, and the data was showing that the hospitals were almost the safest places to be. And it's a tribute to our staff who have been dedicated to maintaining the best care possible and the high quality care for the patients, that we maintained that decorum throughout. And then we developed a COVID unit, and then we took it down, and then we put it back up, and we evolved our care based upon what we were seeing out there. And it really helped us in the long run as a hospital and as a cog within a larger system, because we were able to load balance throughout the various regions and our facilities to have the sickest people cared for at the facilities that had the best the resources for those patients. And then we were able to take in other patients and some less severely ill with COVID. And again, it is a testament to our staff that we're able to do that. And I'm so proud, on behalf of our leadership team, we're so proud that we're able to continue on as well as we did. So thank you all. Next slide. One aspect of COVID, and something that we as a system have developed, was our COVID recovery program. This is a collaborative and coordinated program. Currently, about 350 to 375 patients are in the program in both the states of New York and Connecticut. And it really helps manage the complications and symptoms to previously infected COVID-19 patients. Currently, on the Connecticut side, patients are managed by primary care office in Norwalk. Dr. Kemp heads the post-COVID program for Nuvance Health. And really, we have assets across the board in both Connecticut and New York, with two separate programs helping and mirroring their operations in both states. So what are the long-term effects of COVID? What we're seeing is that the prominent symptoms include muscle weakness and fatigue, memory loss, or that brain fog that occurred. And I have to admit, I had COVID despite being vaccinated, and I had some of the issue of brain fog, muscle weakness, body aches and joint pain. I didn't have difficulty breathing, but that is a known aspect of the issue. One interesting issue is balance issues and trouble walking. People have coordination problems after this, numbness in their extremities, headaches, stroke, abnormal heart rhythms, persistent loss of taste and smell, and even hair loss and rashes. So these are the issues with long COVID. And what's interesting with this program, it's utilizing the newer technologies where, again, the first appointment is really held by telemedicine. You're evaluated with your your history, your symptoms, your risk factors, your prior medications and other treatments, and then the treatments are reviewed by the physician, and then the physician determines to make recommendations based upon what the next steps would be it testing or other therapies. So this is a something that I'm proud to say we are one of the in the forefront of people and systems having these types of programs, and it's working very well, and it's available for all who have issues. So if you have any concerns or questions, please call us on the numbers provided or visit our website at nuvancehealth.org /COVID recovery. Thanks. Next slide. So here's something that we really haven't discussed in 2 years, and this could be part of the great unknown in that what are problems that we never thought we'd encounter in our lifetime. We're used to having the flu annually, and with that, we've developed resistance and we've developed the immunities to actually fight off the flu when it does come. And what's occurred is by not having it over the past year, we are susceptible as a population to the possibility of having bad reactions to the flu itself. So vaccination is still considered the best line of defense, and we are really concerned about potentially this being a more severe flu season because we haven't had the flu in almost 2 years. And in some aspects, we're seeing that in some people, and we're seeing hospitalizations in some people where even last year we never saw that. And what's our best prevention other than vaccination itself? It's what I used to call the big three when we were talking about COVID. And that's, again, social distancing, washing hands, and wearing masks. They do work, and that will help us in the long run to get through a possible double hit with flu and the Omicron version of COVID. Next slide, please. So what are some of the new developments? And we'll go over some of our community advocacy and awards. Next slides, please. Yep. So as part of our quality, we really, I'm proud of, we're in the midst of a once in a lifetime pandemic, and with issues with staffing, etc., we've been able to still tout that we offer top decile performance across the board. We had 0 hospital-acquired infections, so we are doing something right. People are following the rules with washing their hands and wearing their masks and changing their equipment as we move forward from patient to patient, and that's the only way we're going to get there. Our length of stay, which is a tribute to the caliber of the physician care that we're offering and the coordinated care we're offering, is much lower than the national average. And that is actually good, commensurate with good evaluation and quick evaluation in the emergency room. And then moving forward with communication with our hospitalists and with our specialists, we're able to see these issues of low length of stay. Our mortality ratio also was much lower than other national average, and our top performing community hospital the comparison shows that we're better than that. And then finally, which is really one of the areas that allowed us to earn our 5-star rating for this year, was 0 patient safety complications in 10 out of 10 measures. So yes, we are a small hospital, but we offer top decile care, and you still have to perform to get these ratings and to do this level of type of care, which is actually innovative. It's resilient because this is difficult when you have challenges like we've had this past year, and we have to be united in purpose. So I'm really proud of how well our staff has performed over this past year and a half. Next slide, please. In addition to that top decile care, we have also been able to innovate regarding now we are designated a primary stroke center and we received certification from the Joint Commission in collaboration with the American Heart Association and the American Stroke Association. So this is interesting because we don't have practicing neurologists in the area. So how do we do this? This is where coordinated care in a larger system works. Patients show up in the emergency room. Their symptoms are recognized by our practitioners. They immediately go for scanning, come back. We'll have a remote telemedicine visit with one of our neurologist experts in one of our other sister hospitals, and from there determine if they need the clot busting medicine here, or if they need intervention. They are quickly then determined to need tertiary type care at another facility, and transport is currently set up. And then that care is provided, and then they come back to our communities. So if you look, this is really, if you want the epitome of utilizing our facility and what the future of healthcare is, it's the coordinated care that we have with 24/7 capability, with our CT scanners and our teleneurologic consultation, our stroke trained providers, our hospitalists and nursing staff. Everybody is up to speed on those areas. We coordinate care with EMS because we have to transport if need be when they go out. And as you could see by our mortality rates and stuff, we are following the rules and ahead of the game in that regard. And then when patients come back, they receive either inpatient or outpatient rehab services, occupational, physical, and speech therapy, and then stroke support group. So here is modern healthcare where we can utilize the strengths of the practitioners we have locally and leverage them with the providers, I want to say providers, the clinicians that are out in the tertiary hospitals that are affiliated with us, and then still keep our people close to home when all is said and done. That's how you do it. And that's what we want to see in the future with a lot of other aspects of care that we can provide. Next slide, please. So how do we move forward? Next slide. First of all, I'd like to congratulate Dr. Christopher Larock. He's recently been named the Chief Physician Executive for Nuvance Health. He'll provide oversight for all medical, administrative, and clinical functions for the Nuvance Health system. And this will help in a coordinated way to ensure healthcare delivery to pretty much all of our patients. He was recently promoted from his role as president of the Nuvance Health medical practices, and he's really been here since mid-July of 2019. So I really want to congratulate him for the new chief physician executive role, and you'll see him at our facility and locally as he helps us move forward with our various service line growth projections and needs. Next slide, please. So let's talk about our transformation and the progress and initiatives of our plan that we had unveiled in late September. Regarding our labor and delivery unit, as most people know, we have plans to file a certificate of need with the Connecticut's Department of Public Health around the closure of our labor and delivery unit. This is a lengthy process, and it takes time. And this process has changed, and it's many steps have been added. But we are diligently gathering all the information and expect to submit our application within the allotted time regulated by the state of Connecticut. So regarding our other work groups that we also discussed concerning primary care, we're in the process of, I'll show in the upcoming slides that we've been able successfully to recruit in some clinicians to this region, and very proud of that. We've partnered with our federally qualified health center from Torrington. You'll see how that's worked out. We've been able to bring on and work with one of our hospitalists to come on with being a per diem or a part-time practitioner in one of our local practices. So that's helped with our primary care there. So I'm really encouraged by the progress we're seeing there as we move forward with recruitment. We've done and worked with consolidation of our inpatient footprint, and those work groups are moving right forward with hopes of really having the consolidation of some units in our hospital by sometime in January. And then other aspects of the plan that we had discussed include our regional engagement, including roundtables. I've served as a guest speaker at various community-based functions, including emergency medical services in the state of Connecticut and New York, private fundraising activities, and other areas within and other stakeholder groups within our area. So really, we're encouraged by the outreach that the community has brought forward and the interest they have with our transformation plan. And then we will continue with this aggressive meeting schedule through the early parts of next year as we move forward. And again, promising the transparency that we had discussed early on in September. Next slide, please. So regarding awards, community and advocacy in our region, next slide. Again, we've had the community roundtables as noted. We've had active communication with various stakeholder groups, including a roundtable with Attorney General William Tong in October. As previously mentioned, we met with our EMS squads in both New York and Connecticut. We were part of a roundtable discussion with the Eastern Dutchess Rural Health Network. We've also had a very good dialogue and discussion with the Sun River Health, Federal Qualified Health Center from Armenia. We've had various meetings, both public and within our hospital setting with elected officials, going over our plan and our future plans. We've met again with various stakeholders in the community, and even local nursing home groups have been working with us. And I'm grateful for the outreach and just the ability that we're able to partner with our community members and really look at future collaboration as things move on. So thank you. Next slide, please. I also want to recommend, and I almost forgot, that we have set up our medical mobile unit with our FQHC from Torrington 2 days per week on our campus to help assist us, and we will help them with access to various services that we have within our hospital. They offer physicals, they offer diagnostic care, vaccines, COVID testing, etc. within this mobile medical unit. And we're looking to actually expand the service to other areas and other communities in the future as we move on. So as shown here, Tuesdays and Thursdays, you can see the times. And then for appointments, we'll have that phone number available if need be. So I was almost remiss to forget that. We also have made investments in people and care. We have 2 new practitioners in the area shown here, Karen Arell and Tamar Wilms. One will be at the Millerton practice and shared at Sharon, and the other will be permanently at Sharon. So we're encouraged there at that practice, and it's good to see new faces in the community. And we're currently actively recruiting other people in the future. Hopefully we'll have good news in the near future there. As part of our match challenge support grant, not grant, but support from the community from last year, we were able to purchase our new MRI machine. If you saw the construction, we had to take down a wall of the hospital to put the new magnet in. This is one of the more modern MRs in this part of the state and country. It is a very large bore, so it's almost equivalent to some people that have claustrophobia and the open MRI, but this is actually a closed MRI, so we get the best of both worlds. So it's a better experience for the patients, especially those with claustrophobia or anxiety. So I'm really encouraged by this. And then finally, we're working on telemedicine as an aspect of care in our community, and using some of the monies we received from our donations from the foundation and from the community to come up with telemedicine opportunities to utilize our hospital as a hotspot for the community members that have limited Wi-Fi and connectivity issues. They can come to our hospital and actually utilize that hotspot hotspot to actually have the virtual visit, and at the same time have local testing at our facility and imaging at our facility, and go over results with their clinician there. So this is a interesting project, to say the least. We'll start with piloting local practitioners on that front, and gradually expand to specialists from other regions as we utilize this technology further. So I'm encouraged by that. Thank you. Next slide. So with that, again, we have a lot to offer, and as we move forward with Sharon and our plan for the future for long-term sustainability, I'd like to now introduce Jean On to discuss our Nuvance Health strategic plan. So thank you all.
Good evening. Thank you everyone for your time this evening. It's my privilege to present to you our Nuvance Health 2025 Year 2 plan. And on the next slide here, you will see that we have a vision here. Our system vision is to improve the lives of every person in our communities. And I will say, from a healthcare perspective, there is also consideration for making sure that we're doing the greatest good for the greatest number of folks, and that we also are providing healthcare that reflects evolving healthcare needs, whether that's ambulatory care, digital care, value-based care, which we'll talk about in just a second. I will want to emphasize the fact that our foundational success metrics don't go anywhere. Historically, we have focused very much on quality and safety, employee engagement, as well as financial stewardship. Those are elements that, again, we continue very strongly to focus on in our Nuvance Health 2025 plan. However, there are 6 strategic imperatives that we know that moving forward, to be well positioned for the future, we must spend additional time and attention on. And so let me spend just a few moments talking to you about each of those strategic imperative areas. Our first strategic imperative area is person-centered care. We continue to make sure that we're enhancing and improving the patient experience. And in fiscal year 2022, there are 5 priority areas of focus. They include our hospitals, clearly including Sharon Hospital, our emergency departments, including the Sharon Hospital Emergency Department, our institutes. Those include cancer, heart and vascular, and neuroscience, as well as outpatient, including both outpatient imaging as well as same surgery and our Nuvance Health medical practices. Our second strategic imperative, if we move over to the right, is related to primary care. We recognize that this is one of our foundational access channels for our patients. You heard Mark mention the fact that we are investing in primary care. He just mentioned about Sharon and Millerton, as well as the mobile van, and there's continued additional investments coming down the pike here. We recognize that those need to be made such that we can see our patients and others in our communities who need care. A focus also is on making sure that we're strengthening our physician base such that we are working on physician wellness as an example. And then from a patient perspective, we want to focus on care continuity, making sure that patients are seen in a robust health system and a robust, trusted care community. Our third strategic imperative focuses on ambulatory care. Again, a very pivotal access channel, one that patients need and are seeking. And so we want to make sure that we're focusing on developing a robust ambulatory network, as well as optimizing the infrastructure there. And in fiscal 2022, that includes a focus on time to appointment. Can patients get seen quickly for things such as mammography, as well as other high-end imaging, including MR, CT, ultrasound, and the like. Our fourth strategic imperative focuses on digital health. This is an area where Nuvance Health has made great strides in fiscal 2021, and we continue to work on it in 2022. We want to make sure that we have the digital tools, technologies, capabilities such that we are able to transform the care that's needed for our patients and our communities. And in 2022, we are focused again on expanding and scaling up those capabilities, including self-scheduling for our patients for primary care as well as specialty care, and then also expanding the number of our physicians and clinicians who have direct book capability, again, for the ease and convenience of our larger patient populations. Our fifth strategic imperative is value-based care. And here we are again making sure that we are advancing the skill sets and the capabilities to provide population health care. Here, there are a couple of items, not all of which are listed, but as priorities in 2022, we are emphasizing the need to make sure that we're continuing to focus on annual wellness visits for our patients, and by doing so, closing risk gaps that may present. And so again, a lot of work underway in population health, and we will continue to make sure that we're focused here. Our last strategic imperative is focused on network optimization. How are we enhancing and advancing our network, including our institutes, which are core to being able to provide care, whether it's cancer, heart and vascular neuroscience across our health system, as well as our hospitals, including Sharon Hospital. It's important to point out that across the country over the last decade, over 140 rural hospitals have actually closed across the country. And so we want to make sure that we are focused on making sure we have strategic, smart growth for Sharon Hospital, such that we are providing the greatest good for the greatest number of people in the community, and enhancing and stabilizing that hospital for another century to come. You know, Sharon Hospital has been in the community for 110 years, and we want to make sure that we're ensuring the viability and sustainability of the hospital. The next slide here is showing us how there are just two major common themes. If you take a look at Nuvance Health 2025 and you wanted to simplify it, one is we want to make sure that we have access to patients in our health system, whether it's at the hospital local level or at our broader, robust health system level. So whatever care you might need, we can provide it within the environment of our health system. And again, we continue to plug away such that we can provide that access to any patient who might need it across our health system. Similarly, in addition to a focus on workforce, the green overlay demonstrates that we are also focusing on optimizing and investing in the infrastructure such that we can provide access to that care. So at a high level, hopefully that gives you an idea of where we are focused in fiscal 2022 as both a hospital and as a health system, and look forward to any questions that you might have. So appreciate your time this evening, and I will now turn it over to our independent monitors, David McMillan and Dwight Tarwater. Thank you.
Thank you, Jean. Appreciate everyone attending tonight and the opportunity to present to you. As a reminder, PYA has been engaged by the independent monitor to evaluate compliance with the CON order. So we'll get into our report for the period ended September 30th, 2021. I want to probably make a couple of introductory comments before we get into some of the details. So if we can go ahead to the next slide real quickly. These are the kinds of things we're going to cover. We're available to answer your questions here via the Q&A function tonight or offline as necessary. If you'll go ahead now, John, to the next slide. Just as a reminder, excuse me, our role is to report to the Office of Health Strategy in the state of Connecticut. Nuvance pays for our engagement as part of the agreement between the state and Nuvance in the formation of the system. Our job is limited to evaluating those conditions that are in the agreed settlement itself. So there may be issues or questions or thoughts, as have been expressed by some of you, about our role. And I've had the opportunity to speak with a couple of folks from the Sharon community about sort of what our role is and what it isn't. And we've had the opportunity to just catch up on a few matters that were on those folks' mind. And again, term of this 5 years, we're about halfway through that 5-year term with this fifth period report. We'll talk about any change in that in future meetings. Let's move on to the next slide real quickly. So here are the things we're responsible for doing. We do have to do on-site visits, which on-site has meant virtual, basically since somewhere around March of 2020. We do look forward to the opportunity to resume the on-site visits, but we won't do so until it's safe to make those happen. We do have to submit written reports for each semi-annual period the fifth period report has been submitted. We do have to meet with community representatives. There are various forums within which that occurs. This is one of those. And then finally, we have to make some special reporting if Nuvance finds itself out of compliance with any of the agreed settlement terms and conditions. And I wanted to briefly speak to that because I have heard from some folks in this community. As you will recall, and as Dwight will talk about in just a moment, there are specific conditions as it relates to certain services. And Sharon Hospital has made some announcements, as was discussed and referenced in Dr. Hirko's presentation, about some changes that might be occurring in the services provided there at Sharon. As you might imagine, we've been made aware of that, and the system's been good to make us aware of that. But I do want, from a timing standpoint, folks to understand we're reporting on the period ended September 30th, 2021 here tonight. And so anything that might happen in the future, while it's good for us to be aware of it and we can follow it, it's not within the purview of our reporting here tonight. So we will continue to receive information as it's offered by the system. We'll continue to dialogue as we do on a normal basis with Sharon and with the system about the various conditions. And to the extent that there is any activity that is ultimately put into place that results in a change to a condition, or a condition having such as the minimum service condition that we'll reference in just a moment, having not been met for a period without proper permission and or advice from OHS to allow that to be moved into the agreed upon settlement, then we'll be reporting as necessary on that. So I say that to the community in case there's expectations here tonight to know that as we look at the period ended 9/30, we don't have any issues that fall into that category. In fact, as you'll see in just a moment, we don't have any exceptions to any of the conditions that are required to be reported upon during this period. So with that, I'll turn it over to Dwight, who will take us quickly through what's included within this semi-annual report. And then again, we'll be available to answer your questions if you have any.
Thanks, David. So this is kind of our timeline that we've kind of provided here. This will give you an idea of what we've been a part of over the last eight or 9 months here. So starting at the top with those gray boxes, Nuvance is actually required by one of the conditions to hold joint board meetings twice a year. So we've marked those. One occurred in May, and the other one occurred last month. Then right below that, it's kind of our development and submission of our fourth period report. So usually how our timeline kind of works is we'll submit, one of our reports in the summertime and one of our reports in the wintertime. Actually doesn't require that it be on the first. It just kind of surprisingly worked out that way. After that, those goldish boxes below those green boxes were the subsequent community forums associated with that submission of that fourth period report. The yellow boxes below are some other meetings that took place. We had a meeting with Nuvance leadership in May, which included several members of Nuvance leadership, including the hospital presidents. And then over the past couple of months, we've held meetings with what we call PFACs. They're actually patient family advisory councils, which are kind of groups of informed members of the hospital and the community. So we met with each Norwalk, Danbury, and Sharon PFACs October and November. And then that brings us to what we're here to do today. We submitted our fifth period report on the first, and this is our third forum today. So if we can go to the next slide. So I think it's important to note here in this slide that not all conditions are going to be relevant to every period. That's just because different conditions have different timelines, and these 10 to 12 conditions here were relevant to this past 6 months. So we'll start there at the top, and in general, you'll see that we've got yeses all the way down the right side. So nothing out of the ordinary, nothing crazy really to report here, but we'll just go quickly through it. Kind of number 1 and 2 are pretty similar, and it calls for community representation at the hospital boards. Those, since the 4th period ended, those rosters have not changed, and we found that Nuvance was compliant with those conditions in our 4th period, and since those haven't changed, those are still, we still find that we can check the yes box there. As I mentioned earlier, Nuvance must hold 2 joint board meetings per year. They've done that. For 4, this calls for Nuvance to make culturally and linguistically appropriate services throughout the system, available throughout the system. And we actually did a review of all of those policies in our 1st period report, and have been informed that those policies have not changed. So then moving on to number 5, there is that Nuvance must maintain and adhere to current charity care, and if those policies do change, that they must be at least as generous to the community as the prior policy. And Nuvance actually has adopted a new system-wide policy that was implemented in July, which we reviewed in detail, and can confirm that policy, that system-wide policy, is as generous to the community as the prior policies. And then kind of condition 6 on top of condition 5 is that they must give, Nuvance must provide advance written notice to OHS if any of those policies are going to change, which they did. They provided OHS notice in May, and then subsequently made that policy live in July. Moving on to kind of 11, 12B, independent monitor on-site visits. As I mentioned, as David mentioned, those were virtual. We met with hospital leadership, then met with the PFACs as well. Public forums, which we've got the box around, which is what we're here to do this evening. For 15, a few different aspects to this one is that Nuvance must meet cost savings goals for each fiscal year. So in May, Nuvance provided savings related to that first half of fiscal year 21. Since those cost savings weren't for the second half of fiscal year 21 are actually due until November, we won't report on the full year savings until our 6th period report in this spring. So stay tuned for more updates on that. As David mentioned, kind of skipping to number 18 there, we know that labor and delivery services are planning to be suspended. That timeline is going to take a little bit of time. I think it's 8 to 12 months. So obviously we're going to be monitoring that and providing any updates that we were able to update there. And then lastly, 16 and 21 kind of go hand in hand as well. It's just annual updates on any kind of system-wide enhancements and integration initiatives as far as EMR consolidation, achievement of quality measures, maintaining a compliance program, and many others, which Nuvance did a really good job of providing those annual updates as well. So in general, yes is all the way down, and we feel good about the past 6 months. If we can go to the next slide. Next steps here, just ongoing monitoring of the compliance with agreed settlement conditions. We'll continue to check in regularly with Nuvance and OHS, and then we'll have our 6th semi-annual report, next round of on-site visits. Those will be in the spring and the summer of 2022, and then our next public forum will be shortly after that. I think that's all we had. If there's any questions, we're happy to answer now.
Thanks, John.
No problem. Thanks to everyone. So we will open up to questions now. I'm going to stop sharing the presentation, and if any of our panelists would like to, come on video, please feel free. And we are open to questions. You can use the Q&A function or the chat. If you're watching us on Facebook Live, please feel free to ask any questions. I will say, we have been out there quite a bit over the past couple of months, and we do have a wonderful website. It's nuvancehealth.org / Sharon Hospital Transformation, or you can just Google Sharon Hospital Transformation. It's the first thing that'll come up, and that has a lot of information if you need it. So we are open and ready for any questions that you may have for us. We'll give it a couple of minutes to see if anybody joins us. I don't know if anybody else would like to say anything in the meantime, but at this moment, we do not have any questions. So let's give everyone a couple minutes to see if they have anything else to ask. And I don't see any questions on there. So I will once again ask any attendees. Okay, I do see one. There is a question from the community that is, what can we do to help recruit clinicians? I'll turn that over to Dr. Hirko.
Sure. Recruiting to a rural area is always difficult, and we are working as a system with our board, which will be seating a multidisciplinary group of people, including members of the community, members of the board, local physicians, if interested, to actually help in recruiting people to the region and recruiting and maintaining physicians to the region. So there'll be more to come as the board seats that group. But otherwise, it's just a matter of getting the word out. We are actively recruiting. We built residencies in our program and our system to help partially fill the void and difficulty that we've had for recruiting to the area. So we're using all aspects of the different entities that are out there, and even partnering with the FQHC. So those are things that are really working so far, and we're willing to listen to any other suggestions that the community may have.
Okay, thank you, Dr. Hirko. We do have another question. Someone asks, can you share more about our emerging partnership with the FQHC, which is a federal qualified health center? What ways do we plan to work together in the long term?
Well, I'll start with the short term and go long term. Short term, they're working with us in our facility using their mobile medical van to have increased access to the community, the various areas of primary care, and also to help people that are underserved too, that maybe in the past didn't have the ability for that access. In addition, that mobile unit, we're looking for other areas and other regions within our catchment area for this area to be set up so that they can offer that care. In addition, we will be looking at in the near future setting up a more permanent clinic within the hospital itself with the FQHC. And then we will also like to partner with recruitment with the FQHC of people to the community, since they have some designations that are helpful in recruiting graduates, foreign medical graduates, particularly of primary care type of training programs. And then finally, as they obtain some further financing down the road for their North Canaan permanent practice site, we'd like to also work with them as we move forward. But there's the ability to bring in other types of practitioners and partnering with them across the board and do community outreach. So a lot of positive interaction, and the future is just looking bright and on the upswing with them. So thank you.
Thank you, Dr. Hirko. And there's a follow-up from the recruitment question from before, which is basically, this person wants to know, how can the community, is there a way the community members can help with the recruiting? Is there a way the community can band together, offer any assistance to us to help recruit clinicians to the area?
I think it'd probably be important that one, they can actually, if they contact either the hospital or our website regarding our foundation group, they will actually help foster them and move them into maybe the work group that our board members are also moving forward with. So that I think those are good opportunities to work with our foundation and also our board as we move on.
Okay. I do not see any other questions in there. If there are any other questions from our attendees tonight, I encourage you to ask them now, or we will, end tonight's session. I do want to take this opportunity to thank Dr. Hirko and David and Dwight and Jean for presenting tonight. Thanks to all the other panelists for joining us. We do have a thank you from the community for offering this forum. And if there are no other questions, then I will wrap this up. And thanks to everyone for joining tonight. Have a wonderful holiday, and we will see you next time. Okay, take care. Have a nice night.
Good night.
Good night. Thank you.